welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today, on the 10th of October, every year we celebrate the World Mental Health Day. According to WHO, World Mental Health Day 2023 is an opportunity for people and communities to actually unite behind the theme mental health is a universal human right. To improve knowledge, raise awareness, is also drive actions that actually promote and protect everyone's mental health as a universal human right. Now, good mental health is considered to be vital to our overall health and well-being. Yet, 1 in 8 people globally are living with mental health conditions which actually impact their physical health, their well-being, how they connect with others, and also their livelihoods. Now, mental health conditions are also affecting an increasing number of adolescents and young people these days. So to talk to us on this note, we have Miss Aanandita Vaghani, a mental health counselor who have joined us. Miss Aanandita holds a bachelor's degree in psychology at Wesleyan University in City, USA. Having worked in settings with children and adolescents alike, Aanandita learned how emotions and perceptions of them actually start at a very early stage. While pursuing her MA in counseling for mental health and wellness at New York University, she has learned how to deploy emotions in her interactions with clients to actually empower them and change the way they see relationships and the world around them. So welcome to Medical Dialogues, ma'am. We're really happy to have you on board here with us today.
Thank you so much for that generous introduction. I'm so happy to be here.
Great. So as we celebrate World Mental Health today, what according to you are the types of mental health issues or conditions that you routinely observe?
Very loaded question right there. So I think the mental health challenges that clients often present with that we see are anxiety, depression, relationship challenges, and at the core of a lot of these issues is a low sense of self-esteem and self-worth. And I do think though that in the past year, and maybe this is an after COVID boom that we're seeing a large boom in health anxiety disorders. So this is when you get preoccupied with symptoms such as a stomach ache, and then your mind jumps to the conclusion that it's stomach cancer, right? Just a small example of it. But this has been really on the rise, and I've been seeing a lot of clients with health anxiety lately because we're constantly told during COVID, we were constantly told to look out for signs and symptoms of physical illness, right? So wash your hands, check that you don't have a cold, check that you don't have a bad throat, and that made us get into this habit of just this checking behavior that made us more anxious. So I would say health anxiety is definitely one of the disorders that I've really seen on the rise, I think in the past year or two.
Great. So how can we actually reduce the stigma that has been surrounding these various mental health issues?
So I honestly think that we need to make mental health a part of our everyday language, and this needs to change at a systemic level. So all of us go for physical checkups, right, or body checkups, and we check if all our organs are intact. But what about the one organ that runs everything, the brain, right? We need to make sure that mental health checkups are standardized procedure at doctors' clinics. Another thing is pushing people to speak more about their challenges. And in small ways, I try to do this for my clients. I encourage them to speak out to their friends about their mental health challenges to break that stigma, because speaking up and being vulnerable is not a weakness, it's a strength. And having mental health challenges, still being here, kicking and alive, that's such a huge thing that not many of us give ourselves credit for. Just encouraging people to ask for help when they need it. The more we speak about it, the more people will. And that's the beauty of being part of a community, right? You connect over things that everyone goes through, but no one speaks about. And I think most mental health disorders do have isolation at their core. So really getting to speaking about things, making these conversations, even when you're meeting your friends for dinner or checking in with them as to how their day is. I think we need to more commonly speak about these things as a society.
Great. That is very well drafted, very well said. Actually, the more we speak about it, the more address we do, and that's when we actually get to the depth of it. So, if you could just highlight some common misconceptions about mental health that actually need to be addressed?
So the first one is that mental health problems are a sign of weakness, right? And this is the reason we don't speak up about it. And this is no more true than saying that a broken leg is a sign of weakness. Because mental health disorders are illnesses. They're not really signs of poor character, right? And also one of the misconceptions is that if you have friends to talk to, then why do you need a therapist? But there's a big difference between friends and therapists, right? Because friends know your day-to-day living, they might be biased, they don't have an objective view, and they don't have the tools to deal with your mental health just like therapists do. And other common misconception that I've been seeing coming up is that mental health problems are permanent. A mental health diagnosis is not a life sentence, and everyone's experience with a mental health disorder can be very different. Right? Some people experience episodes between which they return to their normal. For some people, there has to be a trigger for it to occur. But either way, the brain is such a powerful organ, and there's this concept called neuroplasticity. Our brain can mold itself according to the behaviors we teach. And studies have shown that engaging in talk therapy, for example, can literally change the structures in your brain. So mental health problems are not permanent. They can be worked on. And the earlier, the better.
Very, very true. Very true. So, how can one promote their own mental health, rather their whole well-being in their day-to-day lives?
So, I think the regular mental health checkups, right? I think one of the best metaphors that I've heard of is therapy. Someone told me this the other day. Therapy is like a vacuum cleaner. It takes off all the stains and dust that you didn't even know you had on your carpet. And honestly, I'm really of the opinion that all of us should have a therapist to talk to at some point in our lives, because there are just so many unchecked beliefs, thought patterns that might be building up that then lead to a bad mood. And, just like we did with the COVID vaccine, prevention is better than cure. So we need to be addressing these things when they come up for us, not when they really hit the roof. So I think in their daily lives, individuals should feel open to reach out for support. I think that's the biggest thing.
Great. So according to you, what role can actually families and friends play in supporting someone with dealing with such mental health challenges?
So like I said, I think family and friends are an and, not an instead of. In your mental health journey. That being said, check in on that friend who says, I don't have the motivation to do anything. Check in on that friend who says, I feel low all the time. They may not be able to say it, but they need you. And when you're reaching out, ask them, do you need a space to vent, or do you need advice? Even ask them how you can be there for them. Because sometimes they might not feel like they can ask you for things that they can. I think with family too, when family members feel heard and understood and loved, it enhances a sense of belonging and self-worth, and this reduces the risk of disorders such as depression and anxiety. And I think the other thing is promoting good communication. So we tend to avoid conflict a lot, but communicating is very important for both friends and family. This can contribute to positive mental well-being because it stops that issue from building up in your mind. Now you have a safe space where you can communicate and share. So I definitely think that's the cornerstone of good mental health.
Well said. So now that we're talking about this in a little bit of detail, what according to you how can workplaces create a more mentally healthy environment for their employees?
So I think a huge thing in workplaces is promoting autonomy, right? Being able to do things on your own. And I think that whether that's at a higher level or the bottom level, everyone should have some kind of autonomy in their job, as well as establishing boundaries, creating norms around communications, but also just responsiveness and urgency of mental health care, right? So, for example, maybe a professional firm can require long hours for a client deadline, but the internal deadlines then you can make more malleable because that is something that you can control, right? Another idea could be, no emails after hours, focused work time, and no meeting days where workers can just work independently. And leaders must also be able to model mental health. And by this, I mean that leaders need to be able to speak up about mental health. When they are giving, meetings or conferences, I think they need to make it part of their everyday work culture to address mental health issues, maybe by speaking out about how they're going through it and how they're getting help for it, because they can be the role model for someone. And finally, the connection of culture is key, right? So,
Yes.
The employers making time for regular check-ins to healthy working relationships, meaningful interactions between teams, and of course, interventions at an organizational level. I know a lot of mental health companies do this, but I, for one, provide a lot of corporate workshops where we address things like burnout, where we talk about things like resilience. And this really opens up more conversations within the workplace. And the more conversations that are opened up, the increased likelihood that workers will be able to remain focused at work.
How now that we're talking about, you also mentioned COVID, post-COVID mental health issues have risen a lot, and we know that the pandemic affected the mental health on a global scale. So, what lessons have we actually learned from that?
So I think the mental health issues that came up during COVID, they weren't new, but it really accelerated the depth and the breadth of the crisis that we faced, right? Because a lot of people suffered from depression and anxiety before, they just didn't speak about it. But now when you're left at home, when you have no distractions, you're going to have to deal with whatever's given to you, whatever things you've left unaddressed, which can be also good, right? Because we're finally coming to addressing that. Though I do feel like certain disorders like substance use was definitely on the rise during COVID, I actually think that the pandemic accelerated long-time efforts in professional mental health and healthcare systems, right, to destigmatize and normalize mental health. I think one of the biggest advances in our era has been tele-mental health. So in the past, when a lot of people would not want to go to a therapist because they don't want to tell their family member that I'm going to a therapist, now they can do it from their computer screen. And I think COVID exposed us to that possibility, and we still use it. Like, I still use it to see clients from Indore, from Delhi, anywhere that's not, because I'm Bombay based, right? So all over the world, just getting access to that telehealth has been a huge thing to destigmatize mental health. So I actually think that, on the contrary, COVID has increased awareness and improved mental health care in more ways than we think.
That's very true. I totally agree. Yes, COVID has definitely created a lot of awareness about mental health, and people are now taking that part seriously, and they are not they're not delaying their counselor visits, and they are more open to this aspect. So now, talking about today's fast-paced world, so what are some effective ways actually that one can manage their stress and anxiety that anyone is having in today's world?
A lot of us run to our work and busyness as a cover for something that we're going through, right? So I really encourage sitting in your feelings, not trying to escape it through Netflix, through scrolling. There's so many distractions. It's so easy to get distracted from the issue, but the issue will keep persisting, right? Netflix and all these things, and even working to an extent, is a band-aid. You're going to have to deal with what's under it. So on a daily basis, sit with yourself. Sit and do a simple practice of journaling out your thoughts. Even using expressive arts such as dancing, singing, it can't be emphasized enough. This is your time to self-express whatever you're feeling. I think another thing is also incorporating a meditation routine into your everyday life. It's very simple, just like a 4-step breathing routine. One of the best things to do is just like do a square breathing where you inhale for 4, hold for 4, and then exhale for 4. And apart from that, of course, seeking help when you need it before things build up. Super important.
Yes, truly agreed. So now we've talking about COVID, we've talking about how in this fast-paced world, mental health has become important and we need to address it. Now talking about young people, the younger generation, how can we encourage them to actually prioritize and also take care of their mental health, because they are the next generation and they are the future of ourselves. So definitely we need to encourage them. So what are your ways?
So honestly, I think because the younger generation, we're so exposed to technology all the time that scrolling on your phone becomes a very easy distraction, and it's replaced actual real connection with people. And good relationships are very important for your mental health and well-being, because they can help foster that sense of belonging and give you an opportunity to share your experiences. So build closer relationships, connect with other people, be physically active, because it can literally improve the neurochemistry of your brain, right? And also build self-esteem and help you connect with others as well. A lot of people take workout classes, for example, which I think is great. Also, just pay attention to the present moment, because this includes your thoughts, your feelings, your body, and the world around you. Mindfulness can help you enjoy life more and understand yourself better. And it can also, foster a resilience that can then help you with your challenges that you go through in life. I think another thing that's been coming up a lot is just speaking to parents and understanding their standpoint about mental health, instead of just stubbing it. Understand their standpoint and explain to them why it's important for you to take care of your mental health, why it's important for you to seek counseling, and they will be more open to it than you think.
Yes, now that you're talking about more awareness and talking about your parents about it. So if I talk about at-home measures, what self-care practices or daily routines would you recommend for maintaining a good mental health?
So, often when we think of self-care, we think of bubble baths and doing like rosy things. They don't have to be that hard. Just very simply, what are some things you do to show self-love? Talk kindly to your body. And this for me equates very closely with mindfulness. Lean into your feelings. Recognize and accept when we set standards for ourselves that are impossible. Talking kindly to our bodies and giving ourselves a break when our body signals it. And then I think also just being aware of how you talk to yourself. Because I really believe this, that 60% of how you feel is how you talk to yourself, is a result of how you talk to yourself. So understand yourself when you fail, when you feel like you're not enough. Analyze that inner chatter and check in with yourself and say, maybe I haven't mastered this yet. It doesn't mean I'm a failure, right? Break down to see what stories you're telling yourself about events that make you self-loathe. And know that you have the power to rewrite that narrative. Draw from your positive experiences to be kind to yourself.
Great. So that was a lovely takeaway message on World Mental Health Day. And definitely, I hope through this, we are able to create as much of awareness and people are more open about dealing with their own mental health issues, and they're more open to visit a counselor or a therapist. Thank you so much, ma'am, for all your valuable insights. It was lovely to be interacting with you today.
Thank you very much. Thanks for the opportunity.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.